Cancer, the C word. Chances are it has touched your life in one way or another. I know it has mine. But what if there was a way you could take control back? If you could own your own cancer? I'm Mike Tucker, and we're here to help you create your best life possible.
This is Lifestyle Magazine with your hosts, Dr. Charmaine Long, Obi DK, Lionel LaMountain, and Mike and Gail Tucker.
Joining us today is patient advocate Dr. Peter Edelstein, who encourages cancer patients to take charge of their health and own their cancer so they can remain in control of this confusing and frightening process. Welcome, Dr. Edelstein.
Thank you. It's a pleasure to be here.
Thank you for being here.
So when you say to own your own diagnosis, what do you mean by that?
Well, as I practiced medicine, I would often see patients who became really passive in their own care. Whatever the doctors or therapists said, go ahead and do it. Not even just cancer, but a number of illnesses. And at other times, I'd see patients who really weren't willing to give up their independence and autonomy. You know, they had owned all these other aspects of their life, raising their kids, picking their careers. And sometimes those people would say, well, wait a minute, I want to understand more about my disease and play a role in this, and I want my wife or my husband to. And I really felt those folks did better. Maybe not even medically, but in terms of their quality of life. And so what I mean when I talk about own your cancer, and again, you can expand it to own your diabetes, own your heart disease, is I think it's important for people to remain in control. It doesn't mean you have to understand everything about your health, but these are decisions that affect you and your spouse and your kids, and you really should think twice before handing over important decisions to people who don't really know you.
This thing about control, this is huge for patients, isn't it? I mean, this can make a huge difference in their attitude about life and even in their dealing with the disease.
I absolutely agree with that. I think learning just the basics of your disease, and for many people they don't understand, you don't have to learn everything there is to know about cancer or heart disease, but understanding the basics and the fact that you know what your goals are in your life for yourself and your loved ones, that should really allow you to play a role in all of the decisions about your care. But, you know, culturally, a lot of people, particularly I think older patients, say, you know, I'm not going to question the doctor and he or she's always right. So you have to overcome those cultural barriers, the things that you've been brought up to believe, which is this is up to them to take care of me.
One of the most basic steps, I think, in that process is just finding the right physician that you are comfortable with. What steps do you recommend for patients to find the right cancer doctor?
Well, first of all, I think you're absolutely right. And I talk to patients about this and I write about this. I say, isn't it fascinating that you came to me as a surgeon simply because your primary care physician, who sees you for 15 minutes a year, said you should go see Dr. Edelstein. I said, you know, you pick your babysitters with way more care than you pick your cancer surgeon. So it is critical to think about finding what I call the right physician partner. This should not be someone who tells you what to do. This should be someone who is a fit for your personality and engages you as a partner. And when you're talking about cancer, you're talking about diabetes, heart disease, these are long-term illnesses. So you really want to find the people who are a fit for you. And no one knows what that fit is better than you do. When you're talking about cancer specifically, I try to help people understand there's a big difference between picking the right surgeon versus picking the right oncologist. Surgeon like me is likely going to be involved with you for a very brief period of time. And unlike chemotherapy or radiation, where you can be in your community hospital and get the same care you'd get at a great institution, your surgeon is really a technician. So whether I'm at a great institution or your local hospital, if I'm not experienced with your specific stage and type of cancer, I'm probably not the right person for you. So you do have to do a bit of research and you have to ask the right questions.
Right.
Well, that's interesting. In your book, you talk about the cancer machine. Is that really just speaking of the whole health industry and how it's set up? It just doesn't make it easy for you to own your own cancer?
Yeah, I think that's particularly true of cancer. You know, we have this population that's aging very rapidly, and physicians are getting busier and busier,
Yeah.
right? So we
Less
have
and
less
less
and less time. And people hear these, what I think are three of the most frightening words in the English language. You have cancer.
Yeah.
And suddenly it's, this is too much for me to understand. I have all these fears. You take care of me. And the cancer machine, to me, it's not intentional. It's not evil. It's just a simpler way for things to work. It's really easier for us to have a patient who doesn't ask many questions, doesn't do a lot of research, just goes along, right? Because we're trying to get through our day and help as many patients as we can. But when that happens, you see things that aren't right. I mean, I talk to patients all the time about their disease and where they're going, and I ask them to challenge, well, why are you going with that physician? Do you know if that physician has experience in that very uncommon cancer? And they go, oh, that's a good question.
Yeah.
So you just kind of flow into this machine, which is all too willing to accept you and put you through.
Yeah.
Can you give us an example of a patient that you've seen and how the concept of owning your cancer has changed their experience?
Sure, I can actually share with you a discussion I had, two discussions I had just in the last week, and I think this also emphasizes the point, it's not just about the patient. They really need their loved ones deeply involved. A friend of a friend of a friend, you know, the old story. Someone called and she was a young woman, and she said, I'm sorry to waste your time. I said, you're not wasting my time. She said, my mother lives on the other coast, and she's been diagnosed with a cancer, and I'm far away, and I'm worried she's not getting the right care. And I said, well, let me learn a little more. Tell me a little more. The woman had a cancer in part of her intestine called the duodenum, and it's a type of cancer I'm sure you're familiar with called an ampullary carcinoma.
Yeah.
These are not very common. And she said she was being cared for by first the general surgeon in her community hospital, and she wasn't sure that was okay. And I said, well, here's some advice. It might be okay. Here's some advice. First of all, I would actually go online to that specific doctor's website or the hospital's website. Most physicians have their interests and their experience listed on their websites. I said, if this doctor doesn't appear to be particularly focused in these types of cancers, I'd call and ask, and I'd literally ask. You can do this respectfully.
Right.
I said, because this is an uncommon kind of cancer where we know that doing this operation infrequently has poor outcomes. Now that opposed to, let me give you an example of breast cancer.
Right.
Virtually all general surgeons do quite a bit of operating on women with breast cancer and are very skilled. This is an uncommon cancer. And in the end, she determined that this surgeon had rarely done this, and she was near a major medical center, and we got her hooked up with someone who was an expert in the field.
Exactly.
And I told her how proud I was. She had made the phone calls, she had overcome those, you know, cultural training of not challenging her doctor, and her mother was in a better place.
Well, it does sound like you've empowered her, and that's the good thing. We're out of time right now, but you're going to join us in our next segment, and we will be right back after this.
Stay with us. There's more Lifestyle Magazine coming up.
We're back with Dr. Peter Edelstein, who is talking about how cancer patients can put themselves in the driver's seat. And welcome to the crew.
Thank you. Glad to be here with the team.
You bet. Yeah, it's a team.
We'll be easy on you.
Thank you. Appreciate it.
In your first segment, you were talking about owning your own cancer, which I love, by the way, putting the patient kind of in the driver's seat. Let's say we have a viewer that was just diagnosed with stage 2 or 3 cancer. What would you say, and you kind of started addressing it over there, what would be the first 2 or 3 steps they'd need to take, you'd suggest right now, for them to really own this process, if you were to spell it out?
Yeah, it's a great question. The first thing that I say, and it's not applicable to every situation, is take a breath. There are indeed a few cancers that are very rapid in their growth, and there certainly are people who come in with very advanced cancers, or they have a cancer that's bleeding or causing pain, and those people can't take a breath. They have to get care right away. But the majority of cancers are not really fast growing.
That's encouraging.
And so you want to take a breath like you would with any other critical decision or pathway in your life. So I say, first of all, take a breath, sit with your spouse, and just get yourself together and make a plan. The plan has to start with picking the right physicians, and we touched upon that a little, doing a bit of research. It's sort of unfair. The burden falls to the cancer patient and the family to do all the work, but you know, welcome to the real world.
Yeah.
But try to find a physician who has experience in your type of cancer, and you made a great point, and your stage of cancer. There are many physicians who are comfortable with early stage cancers, but if you're a patient who has a more advanced stage cancer, you probably want to find someone who has experience with advanced stage.
That's really great advice.
Understand, you know, who's the right fit for you personally, and also who has experience with your exact type of cancer and your general stage of cancer.
Is it common for doctors for doctors to misdiagnose? Does that happen often, and would you say that's rare?
Well, unfortunately, there was a big study published just in the last couple months, I'm sure you're familiar with, that said about 12 million Americans a year, so 1 in 20 who sees their outpatient doctor, have an error in diagnosis or a misdiagnosis. Now, let's be fair, not all of those are cancers, but these weren't trivial things, and some of them were cancers. So the truth is, physicians are only human. We are under increasing time pressure. We're under increasing financial pressure. And no doctor goes to work to say, hey, today I hope I missed something. In fact,
of course.
we really, but if you see a physician for some unusual bleeding or some pain, and you're with your physician and what they're saying they want to do or not do isn't sitting right with you, you have to develop some confidence. And respectfully say, you know, it sounds like you just want to watch us. I'm really not comfortable with that. And I think you'll agree.
I love that.
95% of physicians will say, okay, let's think about this. That 5% who say, well, that's what I want to do, find another doctor.
Well, what about the whole second opinion thing? Sometimes we think that's disloyal to our physician or we're insulting our physician.
You are exactly right. I have a colleague, a non-physician colleague whose wife has very advanced recurrent breast cancer, very aggressive, a mean cancer. And they're being treated in a small town where we live. And I said, you know, we live near a city that has a major cancer institute. What did they say? And he said, well, I didn't want to upset my doctor. And I said, you know, with due respect, my friend, this is your wife's life and his ego. And again, most physicians will say, yeah, seek a second opinion.
Please.
Now, at the same time, for more common cancers, earlier stage cancers, if you have confidence that your physician knows what they're doing, and often that's the case, there is no reason to do that. But if you have a more advanced cancer or a recurrent cancer, a rare one, get a second opinion.
Second opinion
Good
never
advice.
hurts. Never.
I find that there's more talk among patients now about alternative treatments. Can you talk to us a little bit about alternative or supplemental cancer treatments, how to tell the difference and what you recommend?
This is a great question, and you're exactly right. You know, I write about the gentleman who came to me with a very advanced rectal cancer, in fact, incurable. It had been diagnosed at a point when it was curable. Very rational, logical guy, but of course when you hear you have cancer, suddenly logic goes out the door. And he didn't want the surgery, which would leave him with what we call a colostomy, a bag. So he searched around till he found someone who said, I can cure this with wheatgrass juice and some nutrition.
Oh, good.
And of course, by the time he was drained of his money, he had an advanced cancer. And so people said, well, you know, what foreign country did he go to for this treatment? I said, Cleveland.
Cleveland.
So
Well, that is a foreign country.
that said,
We're seen in Cleveland. These are good people.
I don't mean to pick on Cleveland, but the point is, you know, these are not scammers who are distant.
Right.
Yet at the same time, we've learned that nutrition is very helpful. There are studies that show acupuncture can help with cancer-related nausea. There are a lot of things we used to roll our eyes at. I have some general guidelines. Say, first of all, if you can pick something that doesn't interfere with your treatment, it can't postpone your chemotherapy, it can't mean you don't get radiation therapy, it can't put you at risk of infection from your surgery. So as long as it doesn't interfere with your therapy, I accept that. As long as it doesn't break the bank, okay? Because the worst thing I've seen is a couple cases like this where the patient did purely alternative therapy, double mortgaged their house, and then left their spouse after they passed away with debt, which no one wants to do. So think about, this shouldn't interfere with what you're getting from your Western medicine, and it shouldn't break the bank. But then if it makes you feel better and potentially can make you better, God bless you.
All
That's
right,
great.
good enough.
That's supplemental.
We're out of time here. We're going to have to break, but thank you so much for
Thank
helping
you.
us with it. Up next, we'll talk with a cancer patient that outlasted his doctor's mortality prediction by 7 years and counting. We'll be right back.
Stay tuned for more Lifestyle Magazine.
In 2007, Eric Kohlberg was given 3 to 5 months to live. 7 years later, he's sitting with us to talk about his journey. Eric, we are very happy that you're sitting here with us to talk about your journey. Thank
I
you.
am too. Thank you for having
being
me.
here.
Thank you.
Eric, this is one of those situations that this cancer, you hear that label, that term, and I think it really frightens most men. And you've gone through it, and I'm just curious, what was your story leading up to that? And then I just have to know, when you heard the diagnosis, what did you feel when those words came out of your doctor's mouth?
All right. It was as you'd expect, shocking. I was fairly young, 33 years old.
Oh.
And
it usually plagues younger men, I believe.
yeah, it's not too uncommon, testicular cancer in under, between 30 and 40 years of age. I was very shocked, but it didn't really sink in for a while, thinking I am young, that I'm going to beat this thing.
It'll be okay.
Yeah, it didn't really hit me hard until I was laying in a bed a few months later after surgeries and chemotherapy. And then the doctor had said, trying to coach me on how to live my last 3 to 5 months and what to enjoy, and maybe to not think so much about some seeking out like weird treatments or.
Oh, really?
What did you do after he told you that, though? I mean, you've just been told you have 3 to 5 months to live. I would have become depressed. I would have checked out completely.
Yeah, no. Right at that moment, when he walked out of the room, I cried and I cried and cried.
Sure.
And, of course, being a father of 2 young daughters and husband to my wife, my thoughts go right to them.
Oh.
And
Absolutely.
Yeah, just thinking that they are going to have this emptiness inside after I'm gone. And I think there's a lot of guilt that I felt.
Guilt.
Why guilt?
Because I would be the cause of their pain. And the process of being treated, I would feel then also that any kind of pressure or pain that they had was going to be caused because of my sickness. So it was going to be a tough road.
Well, that's really tough because, you feel guilty and yet you don't have any control over this thing.
None at all. But what we did have control over, though, was finding out what we could do after. This is at City of Hope, and being left with no hope.
Yeah.
We kind of just needed to figure out what to do next.
Yeah. So what did you do?
Through somebody at our church had recommended we see a Tibetan doctor. We went to see her in November of 2007, about 5 months after my original diagnosis. And from that point, seeing her, changing my diet drastically, taking herbs and other supplements, in addition to still seeking out with my oncologist, a different oncologist than I had originally had, but seeking out other clinical trials or whatever he could offer me. I was just doing a combination of both.
And that makes so much sense, really. Continue with regular treatments, but find everything else you can.
Yeah, in my situation, I have really a lot to live for. And I think not to look at every alternative is really a disservice to my family.
Absolutely.
Did your family instill within you a sense of hopefulness? Because that had to make a difference. You're here 7 years later.
Oh, definitely. Especially my wife. I would say denial is maybe a quality that she had or that I was able to.
I can understand that.
I relate to that.
And I think that her hopefulness made it a lot easier to get through things where I would never think about a few weeks down the road, and she was, or I couldn't think about what would be happening a month or 2 months, or especially a year from now, because I'm not going to be here. But in the way she would speak, it was as if I would still be there, and we need a plan for what we're going to do.
Was there a point at which there was a shift in your thinking?
Yeah, actually, after we saw the Tibetan doctor, I was pretty spent. My body, I just finished some pretty rough chemotherapy, and I just had a lung surgery, and it was very depressing. But once we saw her, and it might sound kind of silly, but she's telling me she's doing her diagnosis and telling me that she feels a strong life force.
Yes.
And I think that is when things started to change, and I started to feel like we could actually, not necessarily beat it, but
A great chance.
survive.
Yeah.
Survive.
And you actually did.
Yeah.
That's tremendous.
I'm sorry our
7.5
time
years
is
later.
so short, but we thank you for being here, and we'll be back with a few final thoughts after this.
Stay tuned. We'll be right back.
We're back. We've had a wonderful conversation about cancer and owning your own cancer, owning your own diagnosis. So what is the takeaway from this, guys?
Well, I think for me, just listening to Eric, it's learning that there is hope. There, even if you've got that 3-month diagnosis, it may not
Absolutely.
come true.
Sure.
There's always hope.
I really found it helpful with Dr. Edelstein because I had someone really, really close to me who's been going through the cancer process. This whole idea of a second opinion, that disloyalty element you brought up has been huge. And to hear him say, hey, most of your physicians, they don't mind. They would like you to get a second opinion. That was huge to me, to have that permission and approval.
Absolutely. And I think that even more so, if your physician doesn't want you to have a second opinion, that's a huge sign that you need to get a second opinion and find a different
a red
physician.
flag.
Yeah, it's
Use
a real
your
red flag.
resources and don't be afraid.
Don't be
to
afraid.
get
It's your
settled
life.
in. It's your life.
Or
It's
your
your
loved one's life.
Absolutely.
Thank you, guys. We want to thank Eric Kohlberg and Dr. Edelstein for being a part of this one. Check out Dr. Edelstein's book, Own Your Cancer. Thanks for you being a part of this one as well. We look forward to seeing you again, but until then, you take care of yourself. Bye-bye.
Thanks for watching Lifestyle Magazine. Visit us online at lifestyle.org, where you can watch more programs and get more information on our guests. To get a copy of today's offer, call 888-940-0062 or go to lifestyle.org. That's 888-940-0062 or lifestyle.org.